to officiate the opening of 2 official wings at our premier medical facilities, the KTRH, namely the Oncology unit and newly renovated postnatal ward. Of particular interest is the Oncology unit, which is poised to be a relief to cancer patients from this region who have to travel a long distance to Nairobi and other far destinations for treatment. Equally, the opening of Oncology units is a big step in our readiness for proposed establishment of fully fledged cancer diagnostic and treatment center here in Kisii. As you are aware, last week, the President of the Republic of Kenya, His Excellency William Ruto, laid the foundation stone to kickstart the project. Hence, the establishment of modern cancer diagnostic and treatment center in Kisii is now in reality. You may not know, but if we had that facility here, it will serve the whole region, even our neighboring countries. That's Tanzania, which is a neighbor here, and Uganda. The project is a partnership between the government of Kenya, Kisii County Government, Arab Bank of Economic Development in Africa, that's BADEA, and Saudi Fund for Development, SFD. Once completed, Kisii will serve the region in cancer treatment. Kenyatta National Hospitals and Moi Referral Hospital in Eldoret have been our only centers that our people have been going to or have been being referred to. To this end, the establishment of Oncology unit at KTRH goes a long way in ensuring that we are attering ourselves to the forthcoming high responsibility in cancer treatment in terms of getting our medics well prepared ahead of time. For sure, if we have the unit, this unit will have prepared. I've seen Dr. Arati, Dr. Omari, and your colleagues. You know, Dr. Arati, you've been putting pressure on me. When I came in, you told me you're not going to treat any patient if you don't have the safety ward cabinet. And it was going for only 1.5 million. Whereas there were thieves here who were running away with close to 100 million. Save that now we have that unity, and we'll put more of the equipment required in that oncology unit for service to our people. Our effort towards combating cancer has been informed by the rising cases of disease and related deaths in the county. It's estimated, and this is important to note, it's estimated that over 39,000 new cases are reported in Kenya every year. And according to the World Health Organization, reports 27,000 cases of cancer reported are from Western region of Kenya. Western region, that includes Kisii. Kisii County included. Both KNH and MTRH can handle about 9,000 cancer patients in a year, while the rest of the patients visit private hospitals locally and abroad, where they are confronted with high treatment costs. This gives rise to the need to have more public facilities attending to cancer cases to lower the cost of treatment. The KTRH Oncology unit saw over 548 new cancer cases last year. 548. The number was largely attributed to cervix cancer, and it's important to note again that cervix cancer followed by bowel cancer, breast cancer, There is another one called SC4J, cancer and prostate cancer. The palliative clinic has over 2,500 patients on follow-up. This number increases every year because of late diagnosis occasioned by poor health-seeking behavior of our people who seek medical attention while the disease is too advanced. Kisii Cancer Center will serve an estimated population of 10 million persons in Kisii, Nyamira, Migori, Homa Bay, Kisumu, Kericho, and Transmara region of Narok County. And this is our target catchment for KTRH for Oncology Center. Therefore, our target is for 10 million. 10 million runs all the way even to Tanzania, as it were. I encourage, let me say this, taking note of the rising demand in pathological support and cancer patient care, we need more specialists in this area. In readiness for the upcoming of Kisii Center or Kisii Cancer Diagnostic and Treatment Center. I encourage our medics to take up the initiative and take up the space instead of us having to recruit staff from outside once we embark on the project. And I want to plead with our medics. There is a big opportunity. In 18 months, we'll have that facility running, up and running. How I wish that you would have gotten skills, relevant skills for you to operate there. Instead of for us to wait again starting recruiting. Kwa hivyo, kama kuna mgomo hivi karibuni, Dr. Bahati usiende mgomo. Our oncology status in Kisii County includes this important human resource. Let me not trade everything here. Human resource, diagnostic, treatment. No, let me read it. Human resource, we have clinical oncologists, pediatric, hematologist, gyno-oncologist, breasts, oncoplastic surgeon, oncology clinical officers, oncology nurses, among others. Diagnostic, we have plain X-ray, mammogram, ultrasound, CT scan, MRA, pathology services, including histology. We have dedicated multidisciplinary team for breast cancer. NATO wing, which I've just opened. Once now that is renovated, it will relieve mothers and the newborns who will be visiting the hospital. This even as we intend to have the new MCH wing full completed and operational.